some people will panic within the markets that they'll lose a huge proportion of their customers because of the information regarding their ingredients. For example, the alcohol industry might panic that they'll lose a lot of custom from people buying their product, especially the people most susceptible to buying their product. But when the information is available to society, what I think should happen is that people should be allowed to legally sue alcohol companies for not advertising permanent ethanol poisoning. Instead, what alcohol companies are doing is they're advertising temporary ethanol poisoning. And then people are becoming permanently poisoned by ethanol, and for me that means that the alcohol industry is susceptible to being sued for permanent ethanol poisoning and false advertisement for poisoning people. But logically what will happen is that the alcohol industry will admit that they had no knowledge about permanent yeast-based ethanol poisoning, meaning that nobody would be allowed to sue them because there was no common knowledge about the disease, the infection, which would then mean that the alcohol companies would have to legally, in order to avoid future court cases, they would have to legally advertise on bottles and cans and other parts of their produce that consuming alcohol yeast-based products can lead to temporary and permanent ethanol poisoning, which can lead to suicide and manic depression. So I don't know all the laws regarding marketing, but I believe that's what should happen, is that the industry should self-market a warning to its customers that their produce can severely mentally and even sometimes cause suicide amongst people who are suffering with a yeast intolerance. I also think that people who are being treated for manic depression bipolar need to be re-evaluated. They need to be reassessed. In many cases, the people that have relied on the psychological treatments for decades sometimes will probably feel just overwhelmed by all the information, and a lot of the times they'll probably have to continue taking the medicines that are prescribed to them. But when it comes to young adults and teenagers, I don't think that society should continue to psychologically interrogate them and give them psychological treatments when a lot of the time they're just suffering from permanent ethanol poisoning. What needs to happen is they need to be cleansed of yeast bacteria, and then they need to be educated about yeast intolerance, and then they must be given therapy to continue a healthy, active lifestyle, instead of falling into the rabbit hole and the trap of becoming psychologically, chemically imbalanced from taking medicines and from still being allowed to continue drinking and consuming alcohol and things like that. You know, they shouldn't be rejected by society as being deluded. It's wrong to do that to people, especially. It's really bad. It's wrong. It shouldn't happen to people, especially when they're reaching, as they're leaving childhood and they're reaching adulthood. They're just about to start their lives. It's really a disgusting thing to take that away from them and to put them into a hospital, or to put them into a mindset that they're chemically imbalanced. It's not the proper way to treat people. And I understand that in the past these things have happened to people because the medical establishments haven't known better. I know that in the 60s and 70s, and even in the 70s in some nations, people were given electric therapies A lot of the time the doctors just experiment with different drugs to see what makes the patient feel happiest and most capable of continuing with their lives. It's kind of barbaric, the treatments. Even though we're in the new millennium, it's still barbaric because they can't dissect the brain and understand what's going on with it. So all they can do is therapy and psychological chemicals to see what creates the best effect. And it's the incorrect way to diagnose patients and to treat patients. And I hope that it stops very soon. I wasn't sure for how long I would need to speak to best express to people that are suffering what it is that they're actually suffering with, and to give them hope for the future and to help them cure themselves. But I've managed to do it in under an hour, which shows that it's not a complex problem, it's a very simple problem. It's a simple problem, easily understood. It's easily understood. It's just very difficult to manage. And let me explain. A lot of the time if a person visits a GP or a doctor complaining about the yeast bacterial infection, they're given a topical cream if it's showing a rash or it's infected. So for example, thrush. People are given topical creams to treat thrush. In extreme cases when the topical creams aren't working, they're given a pill. That usually cleanses the body. For other times, people are suffering oral thrush and they're given drips that they drip on their tongue. And a lot of the time it can clear up the patient's infection. Sometimes mouthwashes work. But what's happening is a lot of the time people are becoming aware of this infection on the genitals or in the mouth or on the nails. And they're having topical creams and ointments and things to cure themselves of that. But what's happening is all it's doing is it's removing the symptoms in that place on the body. It's not removing the bacteria from the core of the body. It's usually only a long therapy of the pills being taken that cleanses. And I've heard of in some cases it taking 2 months to 6 months, depending on what the doctor prescribed. In a lot of instances it ruins people's lives because they can be infected for years, just constantly combating the infection whenever it flares up, but they never remove it from their core, which means that the only way to cure the disease and the infection is to completely cleanse the whole body. And that's more complex because it means people have to lower their sugar intake to stop feeding the infection. But then that makes people feel unwell, makes them depressed, because they're missing sugars. At the same time, they need to try and effectively combat the infection using pills or injections or some form of medicine. I haven't found one clinic in the entire West that is dedicated purely to the removal of yeast bacterial infections, which is very strange when you consider that there are clinics for people with lactose intolerance. There are clinics and specialists for people with glucose intolerance. But there are very few specialists and clinics for people with a yeast intolerance. I'm going to say something that might offend a lot of people, but if you look online, there are a lot of quack doctors with different treatments for yeast intolerance. Body cleansers, pills, holistic treatments. 90% of them are complete bullshit. They don't work.